Chemical, name of agent, date and time of detection. Red letter with yellow background. Biological, name of agent, date and time of detection. Red letter with blue background. Radiological, dose rate, date and time reading, date of time of burst. Black letter with white background, 28 centimeters per side. Chemical minefield, date of emplacement, front marker facing away. Yellow lettering and stripe with red background. M40 field protective mask consists of a face blank, filter canister, dual voice emitter, assemblies, inlet and outlet valve, and drinking water drinking system. Vocal, gas, gas, gas. Visual, arms extended straight out to the side, bending arms inward while saying gas. Percussion, metal on metal with metal triangle. Mission-oriented protective posture. Commanders can raise or lower through 6 levels of MOP. M9 detector paper, worn around ankle, wrist, and bicep on exterior clothing, will not identify agent, only detect. Color will appear light pink, reddish brown, or violet tint. M8 detector paper, detected on suspected liquid forms, issued with protective mask and M256A1. Nerve agent, green, yellow gold, violet, dark green. Blister agent, pink, red. MOP level 0. All MOP gear available, but not wearing. MOP level 1. Overgarment worn open or closed. MOP level 2. Boots worn. MOP level 3. Mask worn. MOP level 4. Gloves worn. Immediate decon. Technique, skin decon, personal wipe down, operator spray down. Best time, 1/5 minute before. Done by individual or crew. Gains, stop agent from penetrating. Operational decon. Technique, vehicle washdown and MOP gear exchange. Best time, within 6 hours. Done by unit, battalion, crew, or decon platoon. Gains, possible temporary relief of MOP 4. Limit agent spread. Thorough decon. Technique, detailed troop decon, detailed equipment decon, detailed aircraft decon. Best start time, when mission allows. Done by decon platoon or unit. Gains, possible long-term MOP reduction with a minimum risk. Immediate action for nuke attack without warning, without weapon. Face down, head towards blast, cover, close eyes, protect exposed skin, put arms under body, keep helmet on. With weapon, muzzle angled away from face. Nerve agent. Interfering with normal transmission of nerve impulses in the parasympathetic autonomic nervous system. Signs and symptoms. Pupils constrict to pinpoint. Twitching of local muscular. Rhinorrhea. Dysphonia. Diarrhea. Vomiting. Convulsions. Hypersalivation. Drowsiness. Coma. Unconsciousness. Treatment. 2 milligrams autoinjector of 2 pm/cl. Inject in thigh or buttocks for 10 seconds. Attach, use to close. Take up 3 sets. 10 to 5 minutes between injections. Blister agent. Primarily on skin, large painful blisters that are incapacitating. Non-lethal but high dosage can cause death. HD mustard, HN nitrogen mustard, L leucite. Mustard, HD and HN are oily, colorless, pale yellow liquids. Signs and symptoms. Eyes vulnerable. Burns most severe in warm, sweaty areas of body. Blistering begins in 12 hours, may be delayed to 48. Inhalation can cause irritation of throat, hoarseness, cough, dyspnea. Primary cause of death is massive edema or mechanical pulmonary obstruction. Treatment: no antidote. Physically remove as much as possible. Treat symptoms. Lewisite, arsenical. Compound is light to dark brown liquid that vaporizes slowly. Signs and symptoms: respiratory symptoms similar to produced by mustard gas. No pain to skin during absorption. Intense pain upon contact. Treatment: decon eyes with copious amounts of water. Sodium sulfatamide, 30% solution. May be used to combat eye infection within 24 hours. Use British anti-Lewisite. Available in peanut oil suspension for injection. Blood agent definition: interfere with enzyme function in the body, block oxygen transfer, can cause death. Almond-like odor. AC, hydrocyanide acid. CK, cyanogen chloride. Signs and symptoms: death or recovery takes place rapidly. Violent convulsions, 20 to 30 seconds. Respiratory failure with cessation of the heart action within few minutes. Blood treatment: amyl nitrate in crushed ampules, or intravenous sodium thiosulfate solution. Choking agent: excessive damage to alveolar tissue, resulting in severe pulmonary edema. Colorless gas with a pneumophone smell. CG phosgene. Cl chlorine. Signs and symptoms: watery eyes, coughing, tightness in chest, latent systems, rapid, shallow, or labored breathing, painful cough, cyanosis, clammy skin, rapid pulse, low blood pressure, shock, and death. Treatment: bed rest. Keep victims with edema moderately warm. Oxygen. No specific treatment. Incapacitating agent. Comprised of psychochemicals, produces mental confusion and inability to function intelligently. Signs and symptoms: within 30 minutes to several hours to days, irrational delusions, dizziness, muscular incoordination, dry mouth, and difficulty swallowing. Benzoate. Treatment: first aid, no specific therapy. Riot control and harassing. Produce immediate but temporary effect in very low concentrations. Used to harass enemy personnel and discourage riots. Lemon craters, tear gas. Irritants to the eyes, respiratory tract, and skin. CN, chloracetophenone. CS, orthochlorobenzylidine. Signs and symptoms: painful in eyes with excessive tearing. Most severe seldom lasts over 2 hours, usually a few minutes. Fresh air and when in eyes. Vomiting agent. Riot control category. DCDA. DM Adamsite. Signs and symptoms: irritation in upper tract, respiratory tract. Eyes, coughing, sneezing, nausea, vomiting. Treatment: keep mask on, lift to vomit. Wash and rinse with water. Mild analgesic for headache. Recovery 1 to 3 hours. Screening smoke. Primary to obscure vision and hide targets or area. Heavy smoke exposure may cause illness or death. White phosphorus. Pale waxy solid that ignites spontaneously on contact with air to give hot white smoke. Signs and symptoms: irritation to eyes, nose, and throat. Casualty from smoke not occurred in combat operations. Burned skin. Treatment: no, not necessary. Spontaneous recovery is rapid once patient is removed. Contact covered with water, wet cloth, or mud. Freshly mixed 0.5% solution of copper sulfate. Phosphorus particle must be removed surgically.